Hello, everyone. Welcome to Season 2 of the Rhode to Pregnancy podcast. If you're new here, welcome, and we're so excited to have you. And if you've been with us since Season 1, welcome back. I'm Malia, a second-year medical student and one of your co-hosts.
Hello, everyone. I'm Ashley Houlihan, your other co-host and also a second-year medical student. We're so excited to present to you Season 2 of the Rhode to Pregnancy podcast.
In Season 1, we covered many important topics related to the first trimester. So if you're in your first trimester, we recommend listening to those first.
This season, we're going to talk about all things second trimester, including key topics that can bring up a lot of questions, such as ultrasounds, gestational diabetes, preeclampsia, and more.
In the first episode of Season 2, we want to start off with a general overview of the second trimester.
Yeah, it's often called the honeymoon phase of pregnancy. It has fewer symptoms, more energy, and for many, it's when things start to feel real.
So Ashley, what actually defines the second trimester?
According to ACOG, the American College of Obstetricians and Gynecologists, which is where we get a lot of our information from, the second trimester is from 14 weeks 0 days to 27 weeks 6 days, so basically that middle third of pregnancy.
Yeah, and it's pretty different from the first and third trimesters. Early on in the first trimester, as we talked about last season, symptoms like nausea, fatigue, and miscarriage risk are high. In the third trimester, the baby's size brings a lot more discomfort and preparation for birth.
But during the second trimester, moms often feel better. It can feel like a breath of fresh air between those two extremes. They often have more energy, less nausea, and they start to feel those baby movements. It's such a transitional time for both mom and baby.
Right. For the baby, it's all about rapid development. And for the mom, it's when her body adapts to that growth, both emotionally and physically. And that's why we hear it called the honeymoon of pregnancy.
So let's talk about what's happening physically in your body during the second trimester. First, the uterus and breast keep growing. The uterus, which is what the baby grows inside, extends upward and outward to make space for the baby. And that's what starts to show as a visible bump. By the end of the second trimester, the uterus is about the size of a soccer ball.
Your breasts also grow as they get ready to make milk. Wearing a supportive bra can help with breast tenderness.
As the belly expands, your posture starts to change, and that can cause back pain. Hormones in your body, such as one called relaxin, loosen the joints and ligaments to help your body prepare for birth, but it can also make your lower back and hips ache and make your posture a little less stable.
To help with that, doctors recommend low-heeled shoes, good posture, stretching, and resting one foot on a stool if you're standing for long periods. Additionally, the stretching of supporting ligaments may lead to one-sided ache, which is called round ligament pain.
Another thing that can happen is Braxton Hicks contractions. These are mild, irregular tightenings of the belly, and it's really just your uterus practicing for labor. They're usually painless and random, but if they become regular or strong, that's when you call your doctor since it could be something more serious.
Skin changes are common too. Hormones can cause something called melasma, which is darker patches on the cheeks and the forehead. They can also cause the linea nigra, which is that dark line that appears down the belly.
Right. These happen because pregnancy hormones increase melanin, which is the pigment that colors your skin. Most of these changes fade after birth, and using sunscreen can help prevent them from darkening.
Some people also notice stretch marks as their skin stretches quickly during pregnancy. These are completely normal, and they often fade to lighter lines after delivery.
You might even notice some changes in your nose and mouth. Because your body has more blood flow now, your nose can feel stuffy or bleed more easily, and your gums might even bleed a little when you brush your teeth.
Yeah, and that's why taking good care of your teeth is important. So using things like a soft toothbrush, brushing gently, and rinsing with salt water if your gums feel sore can be really important to protect your mouth.
And some people also start to feel dizzy during the second trimester. That's because blood pressure can actually drop slightly during this stage. So move slowly, stay hydrated, and lie on your side if you feel lightheaded.
And also leg cramps. They often happen at night because your muscles are working harder to carry extra weight, and your blood circulation throughout the body is changing. So stretching your calves before bed or using a warm compress can help with these. And sleep in general can also become less comfortable, and you may need to adjust your position, use pillows, and manage those leg cramps or pelvic pressure.
One thing to really pay attention to is urinary tract infections, or UTIs. Pregnancy makes them more likely because hormones slow down the flow of urine.
Right, exactly. If you ever have burning when you pee, cloudy urine, or fever, call your doctor right away because untreated infections can spread to the kidneys and cause further problems.
Now, on the positive side of things, this stage of pregnancy is when morning sickness and fatigue usually get much better. You may have more appetite and energy again.
Hormones like estrogen and progesterone are still active though, so mood changes can still happen. But most people feel emotionally more balanced now.
And some people may notice changes to their sex drive. Some may feel more interested because they finally feel better, while others feel a little less comfortable because of those body changes. Either way is totally normal.
Exactly. So, what's going on with the baby during the second trimester?
Well, this is when the baby starts to look more like a baby. Around week 14, the end of the first trimester, and the beginning of the second trimester, the baby is about the size of a lemon. We have a great description of baby development and sizes as fruits on our Instagram page at Rhode to Pregnancy. But by week 27, which is the end of the second trimester, the baby is typically as big as the head of a cauliflower.
And the reason that the baby starts looking like a baby and grows so much is because bones are hardening, muscles are forming, and the organs like the lungs, the brain, and the heart are maturing.
Around 16 to 22 weeks is when most people feel the first baby movements. This is called quickening. It feels like soft flutters or little bubbles in your belly.
And that's a huge emotional moment. It's the first time many parents feel connected to their baby.
And around 20 weeks, the baby can start to hear. They may react to voices or loud sounds, and some parents even talk, sing, or read books to them.
The baby also practices breathing movements, using muscles in their chest to inflate their lungs with amniotic fluid, which is necessary for lung development. They can also start to suck their thumb, move their arms and legs, and even make facial expressions, which is kind of cute.
That is so cute. And by the end of the second trimester, the baby's body systems are much stronger. If the baby was born very early, around 26 to 27 weeks, there is a small but real chance of survival with intensive care. However, though, these babies are still considered extremely premature.
It's amazing how much growth, development, and change happens in just a few months.
The second trimester also comes with some really important medical visits and tests.
Yeah, the first big one is the anatomy ultrasound, usually done between 18 and 22 weeks. We'll talk about this briefly now, but we will have a much more in-depth discussion in a later episode this season all about ultrasounds.
Right. As a little introduction, during the anatomy scan, your provider checks every part of the baby's body, like the brain, heart, spine, kidneys, arms, and legs, to make sure that everything is growing correctly.
And they'll also check where the placenta is located and measure the amount of amniotic fluid around the baby.
Another key test is called the quad screen, which again we will discuss in depth in an episode on testing, but this is a blood test done around 15 to 22 weeks that looks for signs of certain birth conditions like Down syndrome or spina bifida.
And between 24 and 28 weeks, there's also gestational diabetes screening. This checks how your body handles sugar. You will drink a sweet liquid, and then your blood is tested about an hour later.
Pregnancy hormones can make your body resistant to insulin, and that can cause high blood sugar. If it's not managed, it can make the baby grow too big or cause problems after birth. We'll have a whole episode on all things gestational diabetes this season as well.
Yeah, and during regular prenatal visits, doctors also check your blood pressure, weight, and urine. They're watching for signs of things like preeclampsia, which can raise blood pressure and cause swelling.
They'll also measure your fundal height, which is the distance from your pubic bone to the top of your uterus in order to track your baby's growth.
And of course, they'll listen to the baby's heartbeat, which is one of the best parts of every visit.
As the second trimester wraps up, it's a great time to start planning for what's next.
Around 24 to 28 weeks, most parents start thinking about birth classes, choosing a pediatrician, and planning maternity leave.
Exercise like walking or prenatal yoga helps your body stay strong and flexible for labor, and we'll have an entire episode on exercise this season.
Emotionally, this is a good time to build your support system. Talk to your partner if you have one, family, or friends about how they can help you once the baby comes.
And of course, keep taking those prenatal vitamins that we always talk about, drink water, and rest when your body needs it. The second trimester is really a time of strength and connection. You're finding your rhythm and your baby is growing every day.
It's amazing how your body adapts. From your skin stretching to your heart pumping extra blood, everything is working together to help your baby grow.
Try your best to enjoy this stage. Feel the movements, celebrate the milestones, and trust your body's process.
Every visit, every ultrasound, every kick brings you one step closer to meeting your baby. We know we covered a lot in this episode, but we really wanted to give you an overview of everything second trimester before we dive deeper into specific topics throughout the rest of the season.
Thank you for joining us today.
See you next time.